Fibromyalgia is a musculoskeletal disorder that causes its victims to have widespread pain accompanied by fatigue, sleep, and memory and mood issues. Fibromyalgia is more common among women and is known to run concurrent with other ailments such as tension headaches, temporomandibular joint disorders, irritable bowel syndrome, anxiety, and depression. Today, we want to talk some more about this unseen disorder and what can be done for those who have it. I'm Laura,
I'm Jesse.
I'm the Jericho.
and today we have a guest,
I'm Ducky or Stephanie.
and this is Reconfiguring Reality. Normally, we talk a lot about mental health issues on our podcast, but today I wanted to kind of bring in some more of the invisible illnesses that are out there. Like Chesh has Crohn's disease, as she's mentioned on other podcasts. I think at one time she was diagnosed with irritable bowel syndrome, but I'm not sure if she still has that diagnosis or not. And fibromyalgia is more common one that I know of anyway. So I figured we could talk about this, bring Stephanie in to give us some idea of what it's like, and just to have a conversation about fibromyalgia. Does anybody, Jesse, or do you guys even know? Have you heard of it before? Do you know what it is?
I've heard of it. I think the only reason to a point why is like TV shows will sometimes have like an episode where someone suffers from it, but everybody thinks like the person's pain med seeking and stuff like that, or think like I said, I think Lady Gaga has it.
She does.
Okay, so I was right. But that's about all I know.
And a lot of people do think people with it are pain med seekers or that it's all in your head.
Because isn't it hard to diagnose?
It is very hard, and it's basically a process of elimination type diagnosis.
How long did it take them to diagnose yours?
10 years.
Ooh.
How many incorrect diagnoses did you have before they landed on fibro?
About 3, because a lot of the times it was, here, let's put you on antidepressants, or maybe you should go see a counselor, or just lose weight.
That's my favorite one. Just lose weight.
Yeah, me too.
Because if it were easy, I would have done it already.
Yeah. Well, and I've lost 60 pounds, but I am still having all my symptoms. I mean, it's not like it's a cure-all.
Well, fibromyalgia is actually not curable, right?
Correct. It is not.
And all they can really do is treat the symptoms.
Correct.
Do you suffer from like irritable bowel syndrome?
Yes, I
and
have that. I have rheumatoid arthritis.
Oh, I do remember you talking about that. How it
Mhm.
got so bad the one year that you could barely move.
Mhm. I have multiple days like that, but um the best way I can describe just one major symptom of or I guess it's not a symptom, it's, I don't know, feeling of fibro is if, okay, you know how you have a sunburn, how it feels on the outside of your skin.
Mm-hmm.
Well, fibro is having a burn from the inside to the outside.
So, what's the difference between fibromyalgia and neuropathy? Is it the same pain?
It's similar. Neuropathy does a lot of numbness. Your fingers and stuff tend to go numb and you can't feel them. And so therefore it's hard to do certain things.
Hmm.
But they are very similar.
But they're both nerve issues, right?
Correct.
Oh, because I just read that on the other, fibromyalgia is characterized by widespread pain, whereas like neuropathy is like usually affects the hands and feet
Correct.
nerves.
Yeah. They're localized.
Do you know what triggered your fibromyalgia, or was it one of the cases that didn't have a trigger, it just happened?
Being pregnant.
Are you serious?
Uh-huh.
Which baby hurt you?
I started having symptoms after Shirey, my second, but it got worse after Trent, my last one, who's 13.
Goodness gracious.
Yeah, but my middle is 18 and I started having symptoms after that. And it took a long time for them to realize what it was.
Well, do they know what causes it? Like,
Fibromyalgia, the research I did said that it could be triggered by trauma or surgery, or in Ducky's case, pregnancy, but it doesn't always have a trigger. It can just happen.
It can
Oh.
just happen, but it does happen a lot when a person has childhood trauma, like physical childhood trauma. And it is more of a female illness.
Yeah, I did see that when I was researching. I did see that. So what did your journey look like? Was it your primary care that you started with, and then they sent you to all kinds of specialists, or?
It was the primary care that I started with. She diagnosed me, but she never did anything for me.
Mm.
And so when our, insurance changed and she was no longer part of our group, I started going to a different doctor that was, and she instantly sent me to, she sent me to a rheumatoid arthritis specialist. That particular one did nothing.
Yeah.
She was like, well, we can prescribe you 800 milligram of ibuprofen for the pain. I'm like, ma'am, I was taking that at 15 for cramps.
Yeah.
So, I mean, and a lot of times, well, if you would get more active and, get up, exercise more, possibly lose some weight. And I'm like, if it was that easy, I would have lost 100 pounds by now. But you have to understand with other illnesses and, there's certain things you can't eat and certain things, that like, I don't know how to describe it most of the time.
But my question is if you're in so much pain, how are you supposed to work out if you're in so much pain?
Exactly.
Like, that doesn't make any logical sense to me. Like,
It's not logical at all.
Couple years ago, I started training for 5Ks. I used to run. I loved running, and I was doing 5Ks, and I started feeling like I had shin splints the entire way up my leg. And I went to my doctor, and it was very odd because my diet didn't change, but I started gaining weight as I was training for the 5K. Not muscle weight, gut weight. The doctor was like, yeah, just lose weight and your legs will be fine. I'm working out 3 days a week. I'm running a 5K. Like, it's not, I'm not just
you're
doing
not sitting
nothing.
on the couch eating potato chips.
Right. We're going to the gym 3 days a week. I'm running 3 days a week. Like, and I'm gaining weight. So how are you going to sit there and tell me to lose weight when I'm exercising? How am I gaining the weight? Maybe let's start there. How did I gain the weight? Maybe then I can figure out how to lose it.
I think that's the go-to for every doctor when they see a patient that is slightly obese.
Yeah.
is lose weight and life will be better.
Yeah. I would love to lose at least 30 pounds.
Yeah.
I would love to.
Well, I'd like to lose at least another 30 pounds.
Sometimes I wonder how these doctors like get their license if they just look at a person and say, "Oh, I already know what the issue is. You got to lose weight."
Yeah.
Like,
Yeah, I don't know. I worked in
I-
a pain clinic and I saw people come in for fibromyalgia. That's how I know what it is because of when I worked there. But yeah, a lot of them were flagged because they came in, they appeared to be drug seeking. And I mean, you can only imagine that they're trying to seek some kind of relief for pain.
well,
Yeah.
like the sad thing is when I was down in El Paso, and the funny thing is all of my pain disappeared after I moved away and left my ex-husband. I had no issue. Like, they were happy to write pain medication. Like, that's what I don't get is like mine was all mental. Like, it was manifesting as physical pain, but it was all like a mental issue. But yet they look at me and I'm perfectly fine to sit there and get pain meds because I'm not overweight and I'm not acting like a drug seeker and all this other kind of crap. But yet no one could find out what was going on, but yet they were happy to write me pain meds, no issue,
Mm,
which I don't understand. Like,
I mean, it's pretty standard practice. In the world of medicine, the idea is to do no harm, it's to heal. So if the cure is going to be worse than the disease, they're not going to tell you about it or they're not going to suggest it because it's just adding insult to injury. And so oftentimes what they'll do is they'll just say, hey, there is no way to get past X, Y, and Z, and they're not going to tell you about the rare procedure that only has a 0.05% chance of success, otherwise you're going to die. Because even though, yes, that is a chance, getting your hopes up falsely for such a long shot, and knowing that some people are desperate enough to try things and end up, taking what could be another 2 years of living compared to 30 seconds, right? They just will uh, avoid those topics or really, really downplay them, right? So the same thing goes with diagnosis and treatment. If somebody is saying they're in pain and there's no visible or there's no test that is confirming why this pain should exist, there's one of two options. Either it's psychological, doesn't exist, right? Or they're drug seeking, which is most common, especially like with ER type situations. People come in screaming bloody murder and acting as if their guts are being ripped out, and you know they have a choice to make at that point to allow this person to cat a wall for the next 6 hours or get them their drug fix, right? But it happens. But someone who's rational is just like, I have a pain and it's frustrating and I hate living with it, but they're not like acting like they're dying and their legs getting cut off. They're quick to be like, all right, well, let's see what alternatives we have. But if we can't figure anything out, rather than just randomly giving you treatments, we're just going to give you something to take the edge off or to mitigate the symptoms.
the ER hated me when I got in my car accident when the kids were little. They wouldn't let me leave until my blood pressure and my heart rate went down, but it was elevated, of course, because I was in pain. And I refused to take the narcotics that they tried to push on me. So I stayed in the emergency room for like at least a half hour longer than I could. Like if I would have taken the meds, I would have been out a lot sooner. But I actually refused the meds. I left the script right there in the bed. I'm like, I don't want this.
Which is
So
kind of ridiculous, but
I I I try to find the root cause. I don't want just a band-aid. I want to figure out what the root cause is to see if we can fix that.
I'm going to take a wild guess and say it was the car accident that you're in.
Yes, it was. Absolutely.
So at that point, there's not a lot of detective work there, Sherlock. You just kind of,
They had to do a full body scan to make sure nothing was fractured or broken.
well, that must have
Yeah.
taken like 5 seconds, right?
Right, because I'm so little.
Yeah.
Yeah.
It pretty much just use like a shutter camera, right? Like those old Kodak, just run the wheel and give you a quick click and on your way. Hey, at least you got seen in Pittsburgh, man. I remember back in California, my mom broke her ankle. Her foot looked like it was facing the wrong way. And the nurse came over and was like, well, here's an ice pack, and dropped it on her ankle and then tied it loosely with strings because she didn't want to restrict the flow. So then it slid off her ankle and it was dangling and the string was digging into where it was broken. And we were there for 11 and a half hours for her to get x-rays.
Ouch.
Yeah, and that was a typical day. The ER was an absolute nightmare. I saw people with like head wounds and just arms hanging off, and they're all just chilling and waiting in the waiting room.
Do you suffer from headaches too, Stephanie?
I do. I don't take medicine for them because, little backstory, I was born with drugs and alcohol in my system.
Gotcha.
So a lot of medicines don't affect me whatsoever. And so instead of, taking a bunch just because, oh, I have a headache, this is supposed to help, it never does. So I just don't take it. So we've had a whole lot of trial runs of different medicines and stuff with my primary, and she's absolutely amazing. First off, she, first thing she told me is that, she cannot stand doctors when they tell patients to lose weight. She cannot stand doctors when they say it's just in your head, because it could be in your head, but you don't know that from just talking to them once.
Yeah.
You cannot do an actual diagnosis saying, oh, if you get on antidepressants or if you go to counseling, it'll be better.
Do you still do counseling even though you're on a different regimen?
I do not do counseling myself. I partial childhood trauma. Again, I went through some real hard stuff, and Lorelai knows it. But I had a counselor who took advantage of me when I was telling him what I went through. So I don't like counselors.
Sounds to me like you need the Jericho School of Self-Defense.
Well,
Non-lethal, but extremely painful and effective.
when you're 10 and 11 and, the authorities are supposed to be taking care of you.
Oh yeah, they're all whack jobs back in the day, though. I mean, there was some good ones. Don't get me wrong, but I feel your pain.
Yeah.
My counselor told my mom and me when I was in the room with her, like I wasn't gonna freaking understand what he was saying. But after I was abused and kidnapped, and all this bad stuff that for me, uh, they said, well, because of all the trauma your son went through, he's probably gonna grow up to be an abuser, and he's going to hurt his children and probably the people around him. So I spent the majority of my young adolescence trying to contain myself so that I wouldn't hurt anyone.
Yeah. And, my sister and I both were told that, because of the abuse that we got, we would most likely not have kids. And, things of that sort. And don't get me wrong, my sister and I both struggled. My sister had more miscarriages than I did, but I did have one, and then struggled to get pregnant again. But like, I don't know. I want to say they say those things to you after a trauma to, I don't know, to make you feel worse. I swear that's why they say it. I mean, it's like, because you don't know how your body is going to grow up.
Yeah, and they have no right to sit there and say that you guys most likely won't be able to have children. Is it a possibility? Yes. So they should have prepared you for a possibility, but saying pretty much, yeah, you guys probably aren't going to have kids, so just deal with it.
Yeah, just deal with it. And it's
Does your
like,
sister
okay,
have babies? Did
yes, she did. She has 3.
Perfect.
Um,
You
but
know, my sister
Again,
got
how
her
do these
mouth hair.
people get licenses and keep them?
Yeah, I don't know.
I don't know.
Sorry, and people wonder why I don't keep with therapy. No, that's
I don't do
movies.
therapy. I did try in 2020. Um, it was a virtual, obviously.
Mm-hmm.
And every time we would have a session, she would forget who I was and I'd have to
Oh
redo my story.
no. Ugh.
I
You know,
kind of wish you could
mm,
see the lady I saw. I have this habit of when we get to a specific point, I shut down and I quit. And we got to that point, so I shut down and I quit. But she's amazing.
Yeah.
Therapy should be treated like a normal doctor. People have to remove the stigma behind therapy. Like therapy is not an all-sum game for all people. Like there are people with chronic conditions in the medical world that will be sick their entire life.
Hmm.
There's
Mhm.
nothing they can do about it. They just have to manage the disease and deal with it. They can have a
Yeah.
better quality of life if they manage their disease properly, or a worse quality if they ignore it, right? So
Yeah.
mental health versus some same way. Some people are going to need counseling or therapy their entire life because they are unstable, they're imbalanced, and they're never going to get better.
Hmm.
So it's required. Other people, namely people like myself, who reach a point in their life where everything just kind of crashes down, right? There's a point in their life where up until now they've handled it, everything is kosher, and suddenly there's enough life-changing events that they just can't bear the weight, right? So
Hmm.
I had to reach out to somebody. I had to talk to somebody, and I tried to continue sessions after that, but the prospect of trying to find somebody and all that kind of stuff for me when I didn't need it anymore, in the moment I needed it, I got past what I needed to, and I'm better for it. So I
Hmm.
encourage people to go, but I don't think I need to go every day. I don't
Yeah.
have anything really worth talking about. Although I don't think I wouldn't benefit from going. I also look at the cost versus gain, right?
Yeah.
Like, so if I'm not killing people, if my wife isn't losing her mind, I don't necessarily see a reason that it's
oh
an
well, I
imperative.
mean, I am losing my mind, but I don't think it's your fault.
Yeah, so she's crazy on her own.
But
But
by all means, if it's helping you, then go. I am never once said not
Oh,
to
yeah.
go
No.
no, 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 no.
if you're gonna benefit from it. Um, Problem with me is I don't think I could benefit from it because I have that bad taste in my mouth.
Mm.
And so I don't know. I guess I don't put enough trust in that to think I could benefit from it.
Well, I think that's the key word. And I'm not judging you, don't get me wrong.
No, I get it.
But I think that it would benefit you. I think though you're going to have to find someone that's right for you, just like a
Yeah.
doctor, right? Not all doctors are right for everybody, and not all therapists. When my son needed therapy when he was an adolescent, you know, he hated his first couple of psychiatrists and therapists that he talked to. They
Hmm.
just would kind of just waste his time as he looked at it.
Hmm.
So it took us a couple tries before he finally found somebody that worked. And even then, it still was not like an instantaneous, we're soulmates. It was more like, I can tolerate this person, so I'm going to open up slowly, right?
Yeah.
And then he found what worked for him, right? And I think that is the case with everybody. I think people get a bad taste, like you said, right? They get trauma, they
Hmm.
get fear, whatever, and then they write it off.
Hmm.
And then they suffer a lot more than they would need to if they would just sort of get over that trauma. And I know that phrase is not very popular, but in truth, it's what you have to do.
Yeah.
Like all things in life, whenever someone says you can't just get over this and that, yes, you can.
You
I don't
can.
think
Like
it's getting over. I think it's working through.
Yeah,
well,
it's never
working through
getting
is the
over it.
goal with therapy, but you don't, if you're not seeing a therapist, you're not going to get there on your own, right? That's why people have had these traumas for 30 years, is because they're not getting through it. They're coping at best. So to affect real change, you have to get uncomfortable. You have to face your fears and you have to do things you don't want to do. Like an
And
alcoholic, right? No
yeah.
alcoholic has ever been cured from alcoholism by just drinking a different drink. Like that's never going to happen. You need to quit and you need to quit hard, but you need a solid support system to make sure that you don't go back, right? And every day is a struggle. You're not cured forever. You're always an alcoholic for the rest of your life. You've changed the biochemistry of your body, and you will always be a dependent user if that alcohol enters your system. There is no cheat days. There's no, I can have one
Yeah,
on the celebration or the weekend. The moment you start drinking again, it's a slippery slope.
Yeah.
Right.
well,
And
it's it's just like, as an addict, you sit there, and when you first get sober, you may have to go to a meeting every single day, multiple times a day. But as you get over what caused you to fall into addiction and stuff like that, you may only have to go once a week, and then once a month, and not have to go as often as someone who's fresh out of rehab.
Did you know that our topic next week in 2 weeks is actually on addiction?
what I was gonna say is
Mhm. Sorry,
um,
Stephanie, go ahead.
no, you're good. As you were saying, you're never gonna get over it if you don't work through it. Or I I think I have done really well. Um, I'm not trying to toot my own horn here or anything, but I have worked through what my trauma was without going to counseling because I have found good people in my life who have sat there and let me talk through things.
Mhm.
And
Yeah.
then, and so I think I've done really well with that. Like, I can tell you my story and it not bother me because, uh-huh, okay.
Yes.
Mhm. Exactly. Exactly. Ex-
Minute. I want to know, Stephanie, what your husband does when you have a flare up. What does he do to help you?
He cooks dinner. Like he does takes care of the basic needs in the house. Um, and I've managed my flare-ups pretty good. Um, but there are times where I need to just be in bed because I can't move. And
Does he
he'll
spoil you? Does he spoil you?
he does. He's really good. Like last night, I came home from work and I did not feel good. My body ached and everything. And so he was like, "Well, go take a nap." Well, my nap ran long. And so at 8:30, he comes in there and says, "Babe, you need to get up and take your meds." I was like, "Okay." So I got up and took my meds, and then he was like, "Okay, go back to bed." I mean,
Aw.
it's like, and as I cannot have wished for a better man. I will toot his horn every day. Not that kind, but But he also knows
Jesus.
that I sometimes have nightmares
Uh-huh.
of because I have PTSD.
Yeah.
And there are times where I have nightmares, and then I'll go, you know, 2, 3 weeks, don't touch me.
Yeah.
I
You
just
guys
can't.
you guys met in high school, right?
Technically, I was in high school. He had graduated.
Okay, so you guys were really young when you met. So he's gone through, obviously, he went through the journey with you because of the fibro journey with you because they're his
Yes.
kids. So,
Yes. Yep.
but he knew about the past trauma too.
Yes. Absolutely. That was one thing I do not hide. I don't mind sharing my story at all. I probably overshare it, but
We only have 2.5 minutes left of recording, but you talk about what you want to
no,
talk
I'm
about.
just saying. But yeah, he understands as much as he can.
Do you think that makes it easier for you?
It does. It really does, because he's not going to be like, "Oh, you're taking another pain med." He's like, "Go take your medicine." I mean, it's like he knows that I will stand there and suffer longer than I should because I don't want to be consistently on pain meds.
Right.
Like I can take my pain meds more than I do, but I don't. I mean, because I manage it, and but he knows, he can see it in my on my face that, you know, if I need to go sit down, he tells me. Like we were folding laundry, I was helping him last night, and he said, "Sit down." I was like, "I'm fine." He's like, "I can see it on your face. Sit down." I was like, "Yes, sir." I know. I can't imagine you have any idea about that. Yes.
I think all women do, just to answer that question.
Yes, I'm pretty sure every woman does. And
There have been mornings where I'm like, I am so mad at Dream Jericho right now, so don't talk to me.
yeah,
Well, see, the funny thing is I'll have dreams like that, but it's usually like after I nap at work, and then I have to call Sean and be like, "You are such an asshole."
Oh, thank you so much for being here with us today, Stephanie.
no
Yeah.
problem. Thanks for having me. I wish more people would uh do research on fibro. I went to I had to go see a kidney doctor because we can't figure out why my potassium is always low.
Mhm.
And so, and he explained it to me. He said there your everything looks good with your kidneys. And he said this could be another, you know, symptom of your fibromyalgia. And he's like, honestly, I'm going to tell you what no doctor does. Doctors don't have enough information on your disease or your illness. We're still learning things about it. And so there's not that much research put into it.
That's going to be it for today's podcast. Thank you so much for joining us on our topic of fibromyalgia.
Like, comment, subscribe, all that jazz.
Is a victim an appropriate term?
Victim? I mean, I guess so. It kind of attacks you. Sometimes I feel like a victim.
Okay.